going to talk about gluten-free and dairy-free. Now, nobody's favorite subject, food restrictions. There really is a problem when your basic grain isn't good for most of your population. So you can imagine in the days of social media where everybody has an opinion, there's a normal curve of acceptance of this. So when we look at things like this, we don't ask our hairdresser or our neighbor or our favorite aunt what's going on. We actually do the DNA test for it. And so the DNA test for gluten is called an HLA-DQ-B1 gene type. And after doing 500 of these tests, I developed a pretty strong opinion about what's going on with the United States supply of wheat. GMO'd wheat has with it a sort of an inherent capability to create an autoimmune reaction. So when we're looking at that, there's two different labs in the United States which are considered the gold standard. One is Cyrex Labs, which has very, very, very fancy gluten testing, actually tests for glutamomorphine reactions, which is, glutamomorphine means that you eat gluten and you turn it into morphine. So it's a severe addiction. What we're going to be talking about today is secretory Iga reactions, meaning you eat wheat, your body decides it's a pathogen, and then it develops antibodies against it. The problems with it, this is not common sense medicine. We don't want you to abandon common sense, but we want to add some science and testing to it. At this point, what happens is your body eats the wheat, it decides it's a pathogen, it's a mistake, so it's an intercellular mistake, it reads it wrong, and then it develops antibodies against it. This particular test is from Interrelationship, and it's the one that we really use when we want to knock it down and really understand things. And then it says whether there's a DNA proclivity, what the contributions were from your mom, from your dad, so is it a family thing, and then what the antibody counts are. This is the gluten test from the patient with the severe eczema. So he had been to 12 different doctors, had been to the university systems, had been to the big box store, been everywhere, and they'd done all kinds of allergy testing. They did the Ige Allergy Testing, which is allergies. And again, you don't need testing for allergies. If you have allergies, you know you have them. But this is way more subtle. You don't know if your white blood cells are attacking you, and it does so in such a surreptitious way that you really do need the testing. So in his particular case, the anti-gliadin antibodies were at 228. The lab thinks that you can have up to 10. So when you sort of think about it, how many antibodies against your own brainstem do you want floating around in your system? So even at the 10 tolerance level, we would still advocate that this is a harmful food. In his particular case, he had DNA evidence of problems with gluten, casein, which is dairy, egg, and soy. That's why it produced such an extreme allergic type reaction. So in any case, we don't think that generalized opinions are very useful in individualized medicine. And one of the things I'd sort of like to just caution people that are kind of like my age is that most of our life, the food was actually good. When you were a child, a cow that was milked would last about 20 years. It would get 1 gallon of milk a day. On average, a cow lasts about 5 years now, so much, much shorter lifespan, and it develops up to 5 gallons of milk a day. Well, that stuff is not the same stuff that you grew up with. So the milk is different, the wheat is absolutely different. So there's a whole kind of international, understanding that American wheat is not exportable. So China won't let our wheat there, which is a real statement. Western Europe won't, India won't, Russia won't. And yet this is our standard that we feed to our old people and our children. So basically the science is saying that, the new GMO'd wheat is probably incompatible with most people that live in this country. So what do you do about it? When I first heard that I was gluten intolerant, I'm actually celiac, after my 10th car accident. So trauma turned it on. Trauma was one of the triggers. So if you look back to our autoimmune triggers a couple of talks ago, when we look at the different things that can create sensitivities or can start autoimmune diseases in general, gluten, dairy, egg, yeast, and soy are #1 on the list. Probably hormones are in there, especially if an individual's an older female. We definitely are looking at metals. We're definitely looking at DHEA, cortisol, the adrenal hormones. So what do you do about it? Well, that's the time to get some information. So we're using a guide Linda Clark wrote, and Linda Clark is a functional medicine doctor. And let me just stay on that for a second. In functional medicine is a discipline. I basically studied it for 10 years before I thought I was any good at it. These are the people that live and breathe the details of clinical nutrition. They're not nutritionists. Nutritionists are usually just fancy calorie counters. They're the people who really understand the interworkings of organ function, physiology, food, and the rest of the parts of integrative medicine. So it's fashionable these days for people to take a weekend course. You can actually get a thing that has some kind of a certificate in a weekend on this. This is a lifetime of learning. Frankly, some of my patients that come in here are more knowledgeable than their doctors are. So this is the part where you have to take it on yourself to actually get the real details. Again, this is not a public opinion thing. This is like what's good for you. So gluten is the sticky stuff that holds bread together, but it's in wheat, barley, swelt, kamut, and oats. And so oats, because they're cross-contaminated, that's the only thing we put in that category. Now, it doesn't mean you can't eat the foods made out of those things. You can eat the foods made out of those things. You just have to get them made out of different things. So this is the time to really kind of think globally, act locally. So we're raising teenagers. We need starches. And that's the problem. A lot of the gluten foods are comfort foods. They're bread. I mean, it's in the Bible. So at the end of the day, how do you get bread? How do you get pasta? How do you get, fried chicken? How do you get pizza if you're gluten-free? So there's answers to all those things. And let's just knock a couple of those out of the park. This is corn pasta from Italy. So Italy doesn't have the glyphosate problem, so we don't have to avoid Italian corn. So this stuff has a slightly nuttier taste. It's delicious. I've eaten so much of it, I now think it's the normal thing. So you buy this on Amazon. Let me see if you can see that label. And La Vienzia, and so it's an Italian classic. It's, in this case, it's lasagna, but they have 10 different kinds of pasta. So the pasta thing is knocked out of the park. In the early days, things were made out of sorghum, and sorghum really doesn't taste good. In general, we think that the white rice flours, we think that corn derivatives are really the way to go. So all the pastas, that's done. You're in good shape. Again, we're raising teenagers, so I don't think we could live our household without gluten-free pizza. Now, we actually don't make gluten-free pizza from scratch like this. Against the Grain at Whole Foods makes a perfectly decent $12 shell that it does have some casein on, it does have some cheese on it, so you have to like remove that or change it if you're super dairy sensitive. But the gluten sensitive stuff is fine. You put your own toppings on it, you're in good shape. You can make your own crust, which is probably always the more wholesome thing to do because it won't have any preservatives. But again, homemade gluten-free pizza is delicious, and there's nothing to stop you. Going further, there's things like there's beginning to be pre-made packaging. So this is Krusties, which is, you might identify it from the camping recipes, like for pancakes. This is cinnamon swirl. We made this the other day. We put fresh blueberries in the middle of it. It was amazing. So again, gluten-free eating takes some advanced preparation, but there's almost no food that hasn't been substituted. 10 years ago, the food was dry. The food really just didn't have any kind of mouth feel, and it was really difficult to be gluten-free. It's not so difficult now. So there's an interrelationship between gluten sensitivity and dairy sensitivity. So we all know that our digestive tract, our small intestines, is lined with villi. So these little invaginations look like fingers in the inside of your small intestines that give it the surface area of a football field. So these are actually individually coded for different antibody antigen responses. So let's say my thumb is gluten, and then this one's dairy, egg, yeast, soy. Well, what we know is that it's kind of a resonance. Much of the universe is vibration. So there's a resonance. So if you vibrate with the dairy part of this, you could ring the gluten bell. The gluten bell is much, much more powerful than all the rest of them combined. So we do start with that in antigen sensitive people, and we just take them off of gluten because it's a pretty easy thing to do given an array like this. But then for another group, especially the respiratory group, we want the dairy part to be off of that. And again, the caseo sensitivity, the casein sensitivity can ring the gluten bell, as can any of these. We've had vegetarians from India where because they were eating large amounts of naan, which was the gluten, it actually rang the egg bell. These are strict vegetarians. So there's an interrelationship between these on kind of a resonant kind of a level. So when you're looking to go gluten-free, there's a lot of stuff on the internet. There's a lot of stuff, before or for and against it. But I would put this in the framework of what we were doing before. So you want to understand autoimmunity. You want to understand, is this the chief trigger for autoimmunity? And then remember, idiopathic conditions, we cross off the word idiopathic and we write autoimmune. Gluten-free, dairy-free is the very first thing that you can intervene. In some cases, we're going to go further. We're going to test metals, hormones, stress, whatever all those things are. But in general, this is the place to start, and it's a place that is well-traveled and that you can be successful with.